More, more on the life learning. Yeah, I'm the life learning. The life learning. Get it about. You can't get it about the life learning. Yeah. Okay. Yeah, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Our fellow viewers, welcome to another edition of Salaji. But as usual, just like last week, there is no ordinary Salaji turning point for people of Congo. Right now, the whole nation is preoccupied with what is happening on the ground. But today, I'm not the one man here. This program is going to be hosted by Banka Manneh. Go ahead.
Thank you very much, Ahmed. I appreciate it. I'm sorry. Actually I was in, but I obviously did not see nobody. So I thought, what was what's going on here? But yeah, we are happy to be back for this program that we have here every week, obviously, as everybody knows. And today we have my own brother, Ibrahim Ismail Chongan, who has obviously done so much for his country, by way of service to his country, even put his life on the line for the Gambia. So we are happy to have him. Chongan obviously is no stranger. Ebrima Sawaneh. So Sawaneh, how is it, Suare or Sawaneh? I guess we can we can Suwane, or however we want to put it. I think you can forgive us for saying Sawaneh or Suwane, or however we are used to saying this. But we're happy to have him too. He's been here with us for the last couple of weeks because of his expertise, obviously. Somebody who is very familiar with COVID-19 medical. He's an expert in the medical field, just like our own Ahmed is. So his valuable contribution is something that obviously we are always excited to have here. My own son, Dave Manneh, I don't know, we haven't seen him yet. So hopefully he'll be joining us too very, very soon. Maybe he's running a little late. But today's conversation obviously is a continuation, if we will, of what we have been doing from last week, which has to do with this COVID-19 situation in the Gambia and the impending health catastrophe, really, that I would say potentially impending catastrophe, because the numbers that are coming out of the Gambia on a daily basis now obviously are a cause for concern. Now, hopefully they will go back down because the testing has been intensified, as we understand, and most likely that's what's contributing to the larger numbers we are seeing. But that still means people who are infected in that country that we otherwise would not have known that were there. So, and the picture is not looking good. 40% to 50% rate is not a good picture at all. So we are hoping and praying that that number will come back down, and that the Gambian people will heed sound medical advice from our health experts like Ahmed and Sawaneh, and obviously the policy matters from people like Ebrima Chongan and our medical personnel in the Gambia, the frontline workers, that is, and the WHO. Hopefully you will all listen to these people, their sound advice on these issues, and heed their advice, because I don't know anything, but these folks know what they are talking about. And it's important that we really pay close attention to that. So thank you guys for coming. I guess we'll let everybody go around the table and let everybody introduce themselves, and then we can go from there. Hello?
Hello. Who do you want to start?
Well, Sawaneh, either you or Ebrima can go, but let's.
Hello.
Yeah, assalamu alaikum wa rahmatullahi wa barakatuh. Yeah, I am Ahmed Manjang, from Gunjur. Originally, I'm a medical and molecular microbiologist, or just in one word, just a biomedical scientist. My scientific career started at MRC in 1994. From there, I moved to UK, where I attended University of Reading, where I graduated with a majors in microbiology. And from there, I went to University of Manchester, where I did medical and molecular microbiology MSc. I worked in London for 1 year with a contract research company called GR Micro, where I work on developing two assays. One is to detect Mycobacterium paratuberculosis from fresh milk samples. The other assay was about detecting Legionella pneumophilia from water samples. After 1 year, I went to Bristol, where I worked for Bristol Royal Infirmary as a trainee biomedical scientist, while at the same time completing my registration as a biomedical scientist with University of West of England. From Bristol Royal Infirmary, I went back to the Gambia, and I went back to MRC, where I worked for 8 years. And in November 2012, I joined King Fahd Medical City in Riyadh, where I'm still working, and I'm hoping I'll be going back to the Gambia soon, inshallah. And privileged to sit on the same platform as you all. I'm really excited. Thank you very much.
Thank you. So, Sawaneh, can we hear from you, and then we can go to Sir Chongan last. Go ahead.
Okay, my name's Ebrima Sawaneh. I am Gambian as well. I was born in Mandinari village in Kombo North, and I studied at Gambia College School of Nursing. I did my basic nursing training over there and completed it in 93 December. Worked in Gambia for about 6 months and came over to the UK, anglicized my nursing diploma in University of Plymouth. Then I went into Sheffield Uni, did a medical degree, and then a postgraduate clinical nursing afterwards. And I've been working in the UK National Health Service in various places, and currently work at Leeds General Infirmary in trauma, major trauma theatres. So traumatology is really my specialty, if you want to say that. So I come from a very humble background in comparison to you lot. So I am pleased to be in the panel, and I share my little experience and little that I know about COVID and my personal experiences in looking after these patients.
Mr. Chongan?
Oh, thank you, Banka. Thank you, Ahmed, and my Toma Ebrima. Okay, my name is Ebrima Chongan. I was born in Latrikunda, near Bakadaji Pipeline, and my origins are Kolikunda, near Lamine in Georgetown. And I joined the Gambia National Gendarmerie in 1982 and did my officer training in France in 1985 to 86. Came back, I held various positions in the Gendarmerie as a school commander, territorial Gendarmerie commander, battalion commander, and also the force commander. I did further training in Turkey, my senior officer training, and I did the training in Italy. And when the Gendarmerie was amalgamated with the police force, I was the force assistant inspector general of police in charge of operations. And after that, we have the 94 coup. The rest is history. I came to UK as a refugee, and I had to start from scratch. I went back to university. I studied law. I have an LLB honors. I got an LLM master's in international law. I was called to the bar in July 2007. I have been working for the British Civil Service, specifically for the Home Office, for the last 19 years. I specialize in law and international law enforcement and judicial cooperation. That is my specialty. And I've spent over 15 years being head of delegation, negotiating on behalf of the UK government, various organized crime and some other stuff in the Council of Europe, in the European Union, and in the GA. That's a brief who I am, a humble Gambian citizen from Latikunda.
So, I mean, I guess we can get to the issues now. Hopefully, Dr. Conteh will also be joining us later when he is free, and DF Manneh. Now, you guys, and I know you are all talking from different backgrounds, but still public health direction, nonetheless. If we can start with you, Sawaneh. When you see the numbers trickling in from the Gambia, I'm sure you are paying close attention to what's unfolding over there. As a medical expert, what do you think is happening here, and where do you think this is going?
This situation looks dire. I think is just picking up to rise up now in the Gambia, the death rate. I know there is there's other variables that people are talking about, like the malaria seasons over there at the moment. But what we've seen on TV and from individuals and media outlets in Gambia, plus the Gambia health authorities as well, it looks like it's reaching a critical stage. So this the slope is going up, and it's not reached a level where it will flatten up. So at the moment, it's on the rise, and from what we can see on the ground, it looks a little bit like there's lack of leadership and a bit of confusion in the direction of how to take this. So individuals not responding as they should, in my opinion, and I don't think the government, if they understand the catastrophe this could cause the country, they don't seem to be doing exactly the right stuff that they need to do to curtail and stop the rise of this pandemic and bring it under control. So, like, I'll give you one example, which is, the curfew is kicked in Gambia now, which is in a way is good, but in the medical field with infection transmission, you do it in the morning, and in the afternoon you don't transfer it. It's already transferred. It's too late. So you do all or nothing. So the markets are open. There need to be specific measures in place to stop people from getting into crowded areas, or if they have to for survival, then there need to be proper government measures where social distancing is practiced. The best way from our situation, it looks like, to stop this rise is to make people stay at home. People can't obviously stay at home every day in a poor country like Gambia. The AIDS money that's coming, there's lots of rice have been bought. The diasporas have contributed. A lot of village diaspora groups have contributed. So it looks like all this rice is gone. So you can't make people stay at home. That is not going to work, because what are they going to eat? So there needs to be a reassessment of what needs to happen. Proper measures being put in place in public areas, and also how these measures are executed. There's also people selling. There's stories coming out of Gambia that people are selling face masks in bundles. They carry it in bundles, and people would try it. Will try this mask. One person will try 5, 6, 7 different masks, and then decide to buy one of those. So effectively, those 5 that you've tried, if you've got it, because you can have these without the symptoms and with the symptoms. So if you are asymptomatic, which means you don't have the symptoms, and you've got this, you breathe on those masks, you give it to this guy, he's transferring to the rest of that bundle of masks, then someone else buys it, then they take it home. So it just spreads, it keeps spreading. So I think there need to be proper measures. The government need to come up with specific specific instructions and measures in public areas, on public roads, in shops, in markets, to try and police this and also educate people. It's about health education. If people don't know, they will practice properly.
Wow.
Yeah. So that's
Well,
what I think.
that makes a lot of sense, because I think that's the kinds of concerns that some of us, even that are not medical experts, feel. I mean, when you have people trading some of these materials, it could spell trouble. Mr. Chongan, now we want to talk to you about the security component, because look, with this kind of situation, there needs to be a very, very robust security component to it. That, because in the end, you're going to rely on the security sector. Even in the West, if you notice, they will pass laws to enforce the lockdowns and things like that. So you're going to need, obviously, law enforcement to do their job, to see to have impact. Now, in the Gambia's case, obviously, originally we didn't see much movement on that, or even though stuff were promulgated, but they were never acted upon. But this time around, we are seeing them act on them by way of literally arresting people for breaking the curfew rules, for not wearing masks, things like that. If you were the, say, Inspector General of Police, or even at the policy end, you were, say, the Minister of Interior, if you will. What kind of security measures and what kind of game plan will you have in place to make sure that you both contain the spread of this, while at the same time really making sure that the civil liberties are also protected in that regard?
Oh, thanks, Banka. Okay, I mean, there always have to be a fine balancing act, because obviously this is led by science. But as you said, the security forces are quite important in this. First of all, I think there should be a coordinated action between the Ministry of Health and the Ministry of Interior. As you said, the security forces now, first of all, I think if I was in the government, they would have set up an emergency committee. In England, we call it COBRA. An emergency committee where you would have the health experts and you will have the security forces. This is, as Mr. Sawaneh has said, this is a very serious and very dangerous situation. First of all, both the civilians and the security forces need to be aware of their role. So if at all I was in the government, I would set up an emergency committee which composes of the security forces, the Ministry of Agriculture, and other related departments that have interest in this. First of all, there should be a clear operational plan, because there are policy issues here and operational issues here. There should be a clear operational plan where the army should take over all the guard posts that the police are doing. That will free up a lot of policemen and the PIU so that they can deploy them to do these COVID duties. But as Mr. Sawaneh said, you need to have a strict and clear communication strategy where the Ministry of Health would explain to Gambians, do we have 2-meter rule, 1-meter rule, etc., so that the police are very clear what they're doing. And you can use the army to help in certain instances, for example, escorting the people doing the testing, etc. The army can even help to build rapidly an emergency hospital, because what is happening in Gambia, I'm not a scientist, but you can see that our health system is overrun. There's no two ways about it. Our health system is overrun. And then the policemen, obviously, we have some good commanders there who have experience, and this is an opportunity for them to complete the redemption of the both police and the security forces. So the police forces, the operational commanders, because the police is divided into regions, so every region, the commissioner who is in charge is given enough means so that they will have a rotation. This is a state of emergency. It's going to take some weeks and some months. So this needs a thorough planning, and also the police needs to be giving proper PPEs. The health people should be giving, but the police also need to have proper PPEs. I was watching one of the videos. The police were enforcing the curfew. The policewoman just had a face mask, nothing else. And also, if some of the people, if you stop them, they don't have face masks, and you arrest them, you put them in a station together. So the police should have been having loads of masks, so that if they arrest people, they put masks on them and process them. And also, the police needs to be properly looked after. They need to be giving proper allowances, because you cannot expect them to be working all night. They need to be giving proper allowances, etc. And this is very important, because if this is not handled properly, it destroys morale. Because we have already seen what has happened in the Gambia. They have quoted millions of, billions of dollars. I mean, where is the money? So obviously, the servicemen, if you deploy them outside, they need to be properly fed, properly kitted with PPEs, and also given proper allowances so that they look after their families. So these components are very vital. If you don't do that, you will have to start. Number one, if they don't have proper PPEs, they could get infected and start infecting people, just like what has happened to the medical people, what we are witnessing. So you need that, and you don't want your security forces to be infected, because this is a dangerous situation. There could be a possibility of a breakdown in law and order, etc. So all these things need to be anticipated. So the commanders, I expect, would be able to give clear operational issues. But also from the policy level, at the level of the ministry, they should make sure that police have all the equipments they have. This is not about going to war. I saw some pictures, the police severely armed. This is not about arms. This is about sensitizing the people, explaining to the people how dangerous this is, that we cannot overwhelm our healthcare system, and this is a catastrophe. So it demands a leadership, clear messaging from the government on what action people have to take, like washing your hand, like having sanitizers, etc. But you got to look after the police forces to make sure that they can. This is not just about enforcing the law, arresting people. This is about what we call in England policing by consent, trying to explain to the people what we are doing, because the life you save may be your own, or maybe your brother's or your mother's life, so that people are sensitized properly. But this needs to happen within clear guidelines from the government.
So now, essentially, what we are seeing there right now, obviously, the police has been fully deployed, like I said, and the curfew starts at 10 p.m. and events have been shut down already, where people literally have been arrested. Beyond that, we haven't seen much action from the security forces. What you are saying is that their role should not be limited to this idea of quote unquote enforcement of the SOP, the SOE, sorry, but also to help with maybe setting up field hospitals, or as we call it in the United States, things like that, like a big tent where, the temporal hospitals where people can be quarantined or treated for that matter, because you don't want to overwhelm the main hospitals. Or even escorting the frontline workers and stuff like that. So how do you think that area can, because I haven't seen anything on that part as far as the security forces, their deployment is concerned.
The enforcement of the SOP is not just about 10 o'clock to 5 a.m. During the day, as what Mr. Sawaneh has said, they need to also do a lot of work to make sure that there is no public gatherings where you have a lot of people, so that they have to enforce social distances, etc. So we need to get clear information from the government. What are the rules in the UK? And also every day, the government should have been addressing the country. It's not only the president. Every day, the government should have a sorted hour, like 5 o'clock or 6 o'clock, where a key minister will come and explain what they are doing, because there are a lot of issues here. It's not just medical and security, but there is also economic. So you have to get a fine balancing act, because also our economy is on a life support machine already. You don't want to kill it. So there has to be some kind of balance that people, because let's be honest, our government will never have the money to feed the people and tell them you lock up in your houses. You cannot lock somebody in his houses and he doesn't have something to eat. So all these things need to be figured out properly. How do we open the economy slowly, but in strict guidance with medical advice, i.e. there should be 2 meter or 1 meter social distancing when you go to the shops. In the marketplace, there should be social distancing and limiting the number of people going. So I understand they say all market close at 12. That doesn't make sense. They should stagger it. They should say, all right, the market will open from 6 to 12. There will be a break of 2 hours. It will open again shortly in the afternoon, so that you stagger it. That not everybody will go to the market together from 6 o'clock to 12, and there is a risk of contamination. So all these things need to be done. But you need to get a proper leadership. The government should come every day. There should be a minister, today the Minister of Interior, talking about the movement. Like, for example, the Tobaski that has just happened. I have some relatives. I was very angry with one of my relatives. They went to the villages. They went there with their wives, their kids. They're going to go and infect our uncles there. This is yeah, and they are not even aware of that. So that is why it's very important to have a serious, unambiguous government communication that is clear, that sets the rules. You cannot leave everything with the health minister. It's not possible. The government will be having a briefing every blessed day. Today, the health minister, tomorrow, the interior minister, other day, the defense minister, agriculture minister, explaining what is happening, how many infections we have, what action the government is taking, and how do they mitigate the economic loss, etc. We depend on tourism. What are our strategies now against October, etc. And then, there are a lot of stuff that they are doing. They are not consulting. For example, in the UK, if you come, they quarantine you at home. But a poor Gambia, you want to be quarantined 600 people, you're paying them hotel. I mean, that's madness. So these are some of the things. You cannot have one size fit all. You have some people from the diaspora, they have houses which are locked up. When they come, they go straight to their houses. You could have a COVID police. Make sure where people are going, they can be monitored. They don't go out. So you can do quarantine for people who don't have anywhere to go. So it's not about one size fits all, but you also need leadership to tell the people what needs to be done, rather than everybody just doing things haphazardly. And also, we have to. A lot of people are talking about, okay, we need to have a lockdown. If you lock down the whole country, what's going to happen to the economy? So there are different models. Even in the UK now, they realize that locking down the whole country was probably a mistake. Now they are doing regional lockdowns. They look at where, but to do that, you must have proper statistics, test and trace. You know where the spike is, so that you can lock down that community and then open it up later, so that you have a balance of economic issues and the medical issues. It's guided by science, but this takes leadership. This is not a joke. Right now, we are a very divided nation, and we need to bury the hatchet and come together and address this, so that we can fight it. A divided nation will never prosper. And we are divided. We are not talking about it. We are divided along ethnic, regional, and all these lines. We need to bury the hatchet. We need to come over. I'm encouraged. I've seen a couple of opposition parties came and made some statement, etc. So they need to come, government and the opposition. They need to sit down. We fight this thing as a united Gambia. That is the only way we can defeat this. This is a very this is a threat to the existential of our country.
Yeah, thank you. Ahmed, you just like Ebrima, so let me clarify, Sawaneh in this case. You are a medical expert. So I'm sure the two of you are looking at this with the same kind of lens, different from where Chongan is coming from. He's looking at it with all these security lenses that he has on, thinking, okay, but what about, why not this, why not that, as far as the security component is concerned. You are probably paying much closer attention to actual numbers and extrapolating from it what you need as far as whether you should be concerned, whether you should not be, as we say, whether you should be calm or you should be really worried. And if you are worried, what is the number telling you? Tell us the mode of spread and these tests, the actual numbers. Let's say they come to us and say, hey, last Wednesday, because I understand also that these numbers are not up to date technically, The test that we have performed, say, last Wednesday is the results of that is what we are getting on, say, Friday. I'm not sure about this, but I understand that's what is happening. Now, for me, being the layman, I'm looking at it and saying, okay, so what does that mean? Can you please tell us the mode of spread, the numbers? They do 400 tests, they come back and say we have 198 positives from Wednesday. What are you seeing in this that we should know about?
Yeah, thank you very much, Mr. Banka Manneh. Before I go to the medicals, I have to give credit to Dave, even though he's not here today, for unearthing or reminding Gambians what we are missing. You know, I feel really, really sad when my uncle Chongan started talking, because I know this is the guy we need in that position from the word go. There was a murmur about it. You know, just look at the experience, because I feel like non-entity, you know, he is talking about from the medical side and how things should be run and how we see these guys. We have to highlight this. Why Gambia we make so we retrogress anyway, because we don't put the right people in the right places. You know, the security is as important as anything. And he mentioned something very important. The security service now are frontline workers without PPE. Yesterday, I wrote on my timeline, as long as community transmission existed, we are all frontline workers with PPE. But I don't know how to describe the police now or the security service. Maybe they are frontline workers naked. They are naked because these people don't even know the mode of transmission. They are not properly kitted. They are not properly orientated, like Uncle Chongan rightly mentioned. You're going to be arresting people. Some of them are high on drugs. Some of them are intoxicated, and they are not on mask. So if those people are infected, you know, these police, you know, it wouldn't take a long before we start police coming down, just like the workers. And also, before I go to your question again, I want to go back to something very, very important and significant. Mr. Sawaneh mentioned that need to be addressed quickly. These street hawkers selling face masks, and people are testing them in tons. Which one fits you? You know, just yesterday, 3 days ago, there was a report that asymptomatic carriers actually have the same viral load as those who are signs of symptoms. That's why this COVID is spreading like wildfire. Because in other viral infection, you have to get certain amount of viral load in your system before you even start infecting. But if they are telling us now, actually, those who are not showing any sign of symptoms have the same viral load as those who are showing signs of symptoms, that means they will have the same potential to transmit this virus to the third party. You know, coming back to your question, the numbers we are seeing, you know, Banka, I mentioned it, you know, UDP guys were insulting me that Senegal just need to march into Gambia and enforce these laws to make sure that they are safe and we are safe. And people are talking about their sovereignty, which, you know, some guys are just obsessed with. But when it comes to Gambia and Senegal, to be honest, Banka, maybe I don't know where I come from, maybe ignorance or what, but these two countries are intricately linked. We should forget about imaginary lines.
You are absolutely right. I'm with you there 100%. Yeah.
No. You know, Banka, one of my favorite rounds when I start this conversation, like a daily COVID-19 update, I never stop, even when I see only 7 people watching me, because I know as long as Senegal's numbers start going up, Gambia is not out of the woods. And exactly that's what happened. You know,
that's the truth.
As long as, so Senegal, what they did as far as COVID is concerned, people are looking at them, they are stable for some time. Senegal did something that even England cannot do at the time. They developed their own kit. Even England want to invest on it. But you know, these pharmaceuticals, they are very smart. Then rush in and prepared one, this immunological test. Senegal adopt what they developed for Ebola. They adopt it, and it's working perfect. And this is where Gambia is very, very weak. Testing. according to reports, which I'm not sure, our testing kits are running low. But what is even more worrying, the human resources, the human capital. There is MRC closed their doors to the public. Could you imagine that?
Wow.
Nobody, yeah, they are only concentrating on the patient they have now and their own staff, because
So
they have
MRC is not doing any test now anymore. As far as you guys
no new tests, no two tests. No new tests they are doing. I realize that because my mom have a temperature, I'm worried. So I call my colleagues in there. They say no, they're close to the public. Even staffs, who have new symptoms in MRC are struggling to get tested. Already Gambia is they are releasing positive into the community because they don't have anywhere to take them. Again, Uncle Chongan mentioned that our healthcare is overrun. That's the right word. We are overrun. We are overwhelmed. The number of healthcare staff that are in quarantine is too much. So why we have all these positives coming? Because they are testing people only with symptoms. Could you imagine that? Only people with symptoms they are taking. So those contacts, could you imagine any single positive? You need to go and trace all their contacts and test them. That's why Germany succeeded very, very well, because they've been testing everything and putting them away. But this is the situation. I will let Uncle to come in. We're going to come back and bring you in, because if they don't let you in, we will continue to sort your free service to please advise this nation. We need your advice, please.
Before I come in with another issue, I wanted to ask Ahmed, what is our testing capacity? How much are they testing a day? I know Senegal has risen up to 1,000 a day. What about Gambia? Are we testing 100 or 150? Do we know the capacity we are testing a day?
The most difficult thing in Gambia now, getting data. They even confused, because 2 weeks ago they even lost their laptop. Could you imagine? We doesn't have a code. So right now the figures we are reading is about a week or so back, even though they are telling us is 2 days backlog, but this more than a week. So nobody knows what is going in that country. You cannot quantify it. We mentioned this here a week ago, not a week ago, in fact last Wednesday, that they should take a stock of the number of medical personnel they have who are testing. But there is no data, because they're just taking people to quarantine, and even those in quarantine, they are dodging and going back home because they are not getting any attention.
And also another point I wanted to raise, I think our country now should really use its diplomatic muscle to seek for international aid. I think we need to get a quick field hospital which is well equipped, so that they can remove everybody from RVH or whatever its name is now, and then fumigate it, refurbish it, and so that they make sure that there is standard. Because the problem now is, if some of the health workers are contaminated and they are testing people, they will be giving it to people, and this is scary. So I think our country should not be shy to seek international assistance, so that we can have help. We can have immediately build a new field hospital. Because let me tell you one thing, from a security point of view, nobody can secure our border with Senegal. We have like 400 kilometers in the north, 400 kilometers in the south. The people in the borders are related. If you go to Foni, Senegal have their Foni, they are related. If you go to Badibu, they are related with the people in Rip. If you go to Salom, it's the same. If you go to Fuladu, it's the same. And these are your cousins across the border. So, so as you said, we need to have a coordinated strategy with Senegal. We are a sovereign country, we are independent, but there's nothing wrong. In the EU, they are sovereign independent countries, but they are pulling their resources because they know that they have Schengen borders. Anybody can cross their borders. So that is why we need to have a coordinated strategy with Senegal. We are lucky we are surrounded by Senegal. If we have a coordinated strategy with them, if Senegal goes down, we'll go down. If Senegal goes up, there is no way we're going to go down. We are not an island. Let's forget about politics aside. But what I'm saying is we need leadership in the Gambia. We need leadership in the Gambia to make sure there is a clear communication and clear actions are taken. Because this is a very, very serious thing. But this is not just medical. Medical is the most important thing, but there are security implications. There are also economic implications. I'm happy that doctor is here, the accountant. He can churn the numbers. So we need a coordinated strategy. This is not a joke. The government needs to be coming out every blessed day. You will one minister. It's not just the president to come out and talk with a script. That doesn't change nothing. We need action. The government every day to tell us within the last 24 hours, we have done A, B, and C. These are our difficulties. This is how we are addressing it. And also that they need aid. And also use your diaspora to help. Every country is using their diaspora to help. Yeah. It's not about people don't need position, but you have people who are capable. You have like Manjang, like Sawaneh, and thousands of others who are important in the medical field. By the way, my daughter is a biomedical scientist. So get help. Let them also seek some help so that something is done. We cannot just say ala betayata, ala betayata. I'm telling you, if you say ala betayata, yela sango soto. I don't know how to say at all. You see sango, and you don't show your groundnut. You say ala beta. No groundnut will come. So this is a serious thing that needs to be tackled, and we have no time. This is an emergency.
Thank you very much. Banka, before you go, he mentioned one more thing I need to buttress and highlight, which is another brilliant suggestion. Marketing time. If you said 8 to 2, everybody will rush on. So this will even create unnecessary overcrowding. But if you make 2 shifts, you say, okay, market will open up to 12 and 2 to 6. Then in between, you evacuate everybody, then the fumigators will come in and fumigate the entire market. Even that fumigate, it will do two effect. It will show people that these people are serious about it, and why we are in this condition is really serious. It will send that message. But again, it will make markets safer before the next batch come in, so people can take their time. Oh, okay, so we have 2 shifts. I'll go in the afternoon, or I'll go in the morning, then in the evening I'll go and do. But if we say 1 shift and the time is limited, people will definitely flog it. Thank you.
Wow, you guys are making some very, very, very good points here. I hope somebody's listening and taking notes. Before we go to Dr. Conteh, I want to kind of look back to Sawaneh. Sawaneh, now again, the numbers, because at the end of the day, how the numbers pan out is what is going to determine how many people obviously will die, and and what that means for our country. Then hopefully Dr. Conteh can even give us a picture of that in economic terms. But now the numbers we are hearing, they test 400, 190 something comes back positive, or something along those lines, right? Okay, let's just say 40% or 42, 43% positive rate. Knowing fully well that that's just possibly a drop in the bucket, meaning you have, for every 400 people that they test, there is probably 10 times more out there like that they haven't even spoken to or known that those people came in anywhere near COVID patients or somebody who is even asymptomatic, something like that. What do you think is happening here? How do you explain this?
Right, it's quite interesting. You've mentioned the numbers. Numbers in statistical terms, they don't lie. So the numbers are big. The positive rate is quite high. In fact, it's reminiscent of the Swedish model. In Europe, when the COVID pandemic started creeping up from the south to the north, the Swedish people advised the vulnerable people, the elderly people, to stay indoors and generally leave younger people to still use restaurants and certain age group to go to school. So the thinking behind this is so that you can create a herd immunity. So that means that a lot of people will contact this virus. It's new, so you need an exposure because there's no treatment. If you have an exposure, the thinking is you will develop some sort of immunity to fight it. So the Gambian model, in practice, I don't know whether this is what is their thinking behind it, but is closer to that than other ways of dealing with this, where there's stricter measures. You keep people in, and you try and police it and enforce it. So the Swedish model, the drawback for that is there a lot of people will die if you do that. I'm sorry to say, but you expose too many people to this. A lot of people will die. There's a lot of vulnerable people. In most compounds in Gambia, you will find that someone with high blood pressure, someone who's diabetic, and we all know we don't have an excellent diet. All our fish is going to feed in the pigs in China and other places. So our main source of protein, vitamin C, vitamin C can be a lot of the sources of vitamin C are quite seasonal, are very seasonal in Gambia. So this model it seems closest to that than the opposite one, which is stricter measures. So you mentioned the numbers. That what that indicates is a lot of people will die, but in the long run, it could, we don't know. It could have a more of a beneficial effect, But what this is shown in Sweden is if you do that, a lot of people will die, and this is what is happening in the Gambia. They had more double the higher rate of death compared to other European countries. So I think it's showing that, but we can't afford to do that in Gambia because we don't have the same facilities as Sweden. There's talks that we're running out of oxygen. So when a lot of people get exposed to we don't have a robust health system, they are going to start seeking, treatment. So where do you go? You go to a health center, you go to hospitals, and with a lack of coordination, leadership, and personal protective equipment, what will happen is these people will get exposed to this virus, and they will catch it. I have said this in the past because this is why in the UK, when it all started, what they keep badgering people was stay at home, save lives, protect the NHS, protect the NHS. That's the key. So if you stay at home, you will save lives. You don't get exposed to the virus. You don't go to health centers or health facilities. You imagine 1,000 people in Brikama go to Brikama Health Center. Can you imagine they're going to infect all the healthcare workers? So if they all get infected, who's going to man the hospitals? So this is really important. I think, like Thomas Chongan's just pointed out, there needs to be a coordinated measure. In healthcare, you have to have a structured teamwork. You need to work with different areas to try and effect certain treatment measures and changes. One example is reflective practice, which is key in healthcare practice, is borrowed from the army. So it's good thing to work with the army and the police and other facilities and other services. So you learn from them, and you also teach them about good practice, how to keep safe when you're in these areas, how to prevent yourself from catching it, because their services are needed. All these government services need to be mobilized to try and contain this, because it's everywhere. And I think the big cosmopolitan areas need to be shut down, like he's mentioned as well earlier. Is really important because the economy, as we know in Gambia, is not robust either. We have an economist in the panel; he could digress on that. So if you have a targeted shutdowns, in like the epicenters, Brikama seems to be one, like big cosmopolitan areas, Serekunda, stop people from going to rural areas, coming in and out. You stagger access to services. It will all help, but the numbers are not looking good for Gambia. We need to work as a team and and with different health facilities, you know, like the Senegalese people. That's the whole idea. You work with these people, so you learn best practice from them. So we have to work with the Senegalese because they seem is evident they're doing better than us. We don't have good services like people are talking about test and trace. I mean, but how do you trace these things if you don't have internet access? You know, in most rural areas, how do you do that? You just can't. So the best thing is to try and contain it now and stop it from spreading out further. I think that would be the best. So the numbers will then hopefully slowly come down, and then we'll be able to control it. And I can't underestimate also the healthcare workers are working in some difficult conditions. There's been samples in Europe where health facilities, when they get overburdened, they walk away because we all signed up to look after patients. But what it teaches us also, healthcare teaches us, is you have safety first. Safety first. So if you're not safe, you don't go. It's probably similar in the military. If you don't have a gun, you don't have a knife, you don't have an armory, you don't go in the middle of Iraq to try and shoot somebody. You know, a war zone, you get killed. So safety is important. So, you know, this is why I need personal protective equipment. If there's not enough of it, or there's not access to it, people could start dodging going to work or get poorly themselves, and that will lead to a total collapse of the healthcare system, and that's really bad news.
Wow.
Yeah.
Now, thank you very much, Sawaneh. Brilliant take there, Dr. Conteh. I mean, you are a numbers guy. You're an accountant. For you, you are looking at, okay, what's the economy looking like? I mean, what's the balance sheet looking like, if you will? The debit and the credit side of things. Give us your take. What is the statistical model here? Because 10,000 people in the Gambia, in the broader scheme of things, 10,000 infected people in the Gambia is different from 10,000 people infected in Senegal, because obviously the population is different. Donald Trump is making that same mistake when he says, no, but if you look at our numbers, we are better than most of these countries. And they are telling him, look, those countries are 30 million people and you are 300 million people. So you can't sit here and say you have 2 million, and then because they have, 40,000, you cannot, there is no way if you compare it like that, you will be making a huge mistake, because the numbers are just not the same. Britain can have, 10,000 to Britain means 2 million to United States, possibly. So you cannot sit here and claim that Britain is worse off than you are. You'll be shocked at how different the numbers are if you really put them in a model like that. So you are looking at this, Dr. Conteh, and saying to yourself, okay, we are 1,000 plus now. Gambia is 1.9 million people, maybe. By the time this is all over, how many people?
Banka, can I help? Can I help you there?
Oh, yeah, go ahead, and then we can go to him, and he can tie it, because I want him to tie it to the economic.
If you want to compare, if you want to compare Gambia and Senegal, always multiply Gambia by 8. Gambia's number by 8. That will give you a relative compare. Yeah. You look at number of positive, 8 by that's 8,000. That's very close to what's it. So always you multiply any number in the Gambia by 8.
By 8.
Then you can compare the two. Yeah. Yes, they have 16 million.
So
we have 2 million.
You cannot say, oh, but Gambia has only 1,000. Look at Senegal; they have 7,000. Well, technically, Gambia has more in statistics terms, right? That was the case I was even making when I was talking about Donald Trump. I hope I made any sense there. Yeah. But Dr. Conteh, in economic terms, what are the ramifications here? Where do you see our economy? How is it going to shrink? Or, I mean, I know you probably are not an economist in real sense, but with your accounting numbers, hopefully you can be able to help us be able to kind of delve a little bit into that. Dr. Conteh, are you there? Yeah, Dr. Conteh? I think Ahmed, I think
it looks like it's gone, but like Ahmed just said earlier there.
He's on mute. He's on mute.
Yeah.
everything's on relative terms. You can't compare Gambian numbers directly to any country as such unless you look at their population size. So it will be wrong to suggest that we're doing better than Senegal because they have a much bigger population size. So in fact, we're doing far worse. Senegal seems to have got things on the wrap at the moment. We haven't. Ours is climbing on daily basis. So it looks like it will get even worse. So that comparison is not right. Just like Mr. Manneh, Banka, you've just said, you can't compare China with or India with America because they have a much bigger population size. So
correct.
Like he just said, you have to multiply it by 8 to give you a better indication of what really.
Exactly, and that was the main point I was trying to make. That is, in India, for instance, maybe UK was a bad example, but say India can, with 2 million people infected over there, US 2 million, or India 2.5 million, or even 3 million people infected. You cannot sit here and say, oh, US, we only have 2 million, look at India, they have 3 million. Well, sorry, but the numbers just, India is in a far better position than the United States in that regard, because they are 3 million and they are 1.5 billion people. So that was the point, exactly the point I was trying to make. Dr. Choneh, are you there? Because his lines on my end is frozen. I don't know whether
he's back again, but he's mute.
Right.
Okay. I
he's muted.
Banka, can I ask a question to the people?
Go ahead. Go ahead, Ibrahim.
Yeah, I just wanted to ask Manjang and Sawaneh. I mean, there is also another issue about the reliability of the testing in the Gambia, because I cannot understand where you can say somebody is COVID positive, and then after a couple of days you say, oh, he's been tested, it's negative, or the test is inconclusive, because this is also a potential hazard and danger. So I would like you to enlighten us on that.
I'm glad you asked that. By the way, before I can add to the question, I will add to your question. I'm glad you asked that. The vice president, to be more specific. I hear people say, oh, I know, Chongan, you are not going to go there, but I will go there. I hear people say, well, the vice president was, how can she be positive just 3-4 days ago or whatever? And then now they are telling us she's negative. Maybe it's not true. I mean, something along those lines. Or how can she be cured? I hear all those kinds of questions. You're a medical expert. Please explain to us how that dynamic, how does that work? What exactly you think happened there?
Yeah, let me come. The test actually don't test if something is living or not. It's like a forensic, molecular forensic in security. Like you go to somebody's property, you throw a spit, and when the forensic come, they scrape that and go and text it molecularly. It's the DNA. That's the deoxyribonucleic acid. So the virus can die, but the nucleic acid material can still be floating in your system. So and these tests are very, very sensitive. How the PCR work is that, like you have a jumble of things, say apple, bananas, but you have something that can go there and latch onto one of these, like the orange, and multiply them. So eventually orange will become more than anything because it's only multiplying oranges. So this genetic material also, they are floating. There are different kind of them. But this particular test is specific to only COVID. So it will go in there and pick on the COVID DNA and start multiplying it. So even if you recovered, but you still have the remnants of this DNA in your system, the test will pick it and multiply it, and you will become positive. But say after 24 hours, maybe now your system got rid of that remnants, so you will become negative. That's why we don't report this as positive or negative in our medical report. We say target detected, because the target you detected might be living or not. But when you come to the general public, you have to tell them Kari is either positive or negative.
That's what they understand. The layman understands only positive, negative. The moment you start talking target detected, target, they might be sitting there, what the hell is this target thing that they're talking about? Okay, that makes sense.
Yeah, so it's possible. So say you tested somebody who already recovered, but the body is in the final stage of getting rid of those molecular DNA, genetic elements. It will pick it and become positive. But after 24 hours, maybe he got rid of all them. So that's a possibility. And there is this thing also called transient infections. Anytime we go out there or in our houses, we are bombarded with different kind of pathogens. But if your immune system is working perfectly, it deal with this most of 99.9%. But simple things, even like say your wife is giving you hard time in a 24-hour time, your mood is down, you are moody, your immune system also goes down. So during that time, one of these pathogens can take that opportunity. That's why we call them sometimes opportunist infections, like some thieves are. They will be hanging around, but once they know that your immune system is down, they will capitalize and got hold and overcall them. So this is why it's advisable to keep our moods up.
These are living, breathing. So in essence, people, lay people like me, don't realize these are living, breathing organisms. They are also, and they are smart. They are looking around and then kind of, saying, okay, let me see, okay, let me strike here. And then you find it there and say, okay, maybe this one I missed this time. Let me see, boom. And then is that how it works? Like we are playing hide and seek with these infectious diseases?
That's how it works. In fact, it's so clever. If you read it and you happen to be religious, it makes you stronger. Because Banka, these things are so clever than us. Because successful pathogen aims and objective is not to kill the host. Because if you kill the host, you have no food. So they have a way of making so that they can feed, but they don't kill the host. And they have a way also playing hide and seek with your body soldiers. That's your immune system. In fact, one of the clever way, one bacteria, what it does is it takes some elements of our blood, what they call fibrin. This is a protein that helps our blood to clot. So they will convert that into something else and cover themselves within it. So when the
bodies like soldiers do in the battlefield, where they wear a uniform and then kind of
but that is camouflage. But this one will dress in such a way that when your body immune system come in contact with them, it will take it itself. It belongs to themselves. So you can understand. So that's the difference between. So it's so complicated. This is a situation we have. Unfortunately, we are in serious trouble. We cannot be embarrassed or ashamed or be arrogant. We need to seek international help. But that is done by a government. But right now we don't have one. So this is the situation we are in.
Okay, I can hear you now. Can you hear me?
Okay.
Can you hear me?
Yeah, Doctor, we can hear you. I can hear you now.
Okay, my prediction is that the Gambia would lose almost 50% of revenue from March to.
Say it again. I lost it there. You said Gambia will lose what?
I said Gambia will lose almost 50% of the revenue projected for fiscal year 2020. We will lose that, and in fact, if we compound that, it should be almost $10 billion. Because remember, when the country actually makes its budget, they record grants that have no obligation whatsoever to be paid by the donor. So with all the problems in the Western countries in terms of this COVID and the limited budget that those countries have or organizations have, we will have a serious budget deficit. So if we predict that we're going to have about $20 billion of revenue, I can project to you that the Gambia will lose about 10 billion. And I also want to thank you for inviting Balamba to come here. We hope we can see him every week when he has time. But one thing that I'm very concerned about, a family member told me that they have some kind of charm in the Gambia that if you put it on, you will not catch COVID.
Our people are crazy.
So, and what you said something that that puzzles me. Are you saying that people are selling masks on the street?
That's correct. That's the evidence coming from Gambia. People are selling masks from street. I mean, this is terrible. I mean, I think the government should take total control over this sort of thing. This is emergency. You measure it, you size it up. One size fits all. You don't need to try different sizes because they should come in different sizes. One size fits all for adults, and then you make that as a rule, a regulation. Then you sell it out. So there'll be no need to keep trying different masks.
Okay, thank you again, Mr. Manneh and the two Kabungas here, and Balamba. I'm going to put him on the spot because we need this gentleman. We should have had him a long time ago. So we hope we see you coming in on Mondays. Check your schedule because you've said some stuff that I think I was not even aware of in terms of security, saying that getting the military to come and take control of certain sites, and that will freeze up, the paramilitary and the police. So we need to do this together. And you said something that I also agree. There is no time for politics, because some people were jubilating when the president's wife took ill, and I just cannot believe in a country of 2 million people, even if we are 20 million, 30 million. In times of crisis, I don't think we should have any political line. We should come together as one. So I'm not an expert, but I want to add something which I think the Gunjur media online really did a wonderful job. Some of the people who returned from Senegal, northern Senegal, to Gunjur, and some of their villagers were out there by the seaside, and they escorted them. They called the immigration. Immigration came and got them. As we have porous borders around, even where I come from, I'm very frightened about what is going on. And then you said something about Badibu. Yes, indeed, that is true. We have porous borders around our area, and all we need to do is our government. Yesterday, I said, we should not be ashamed to ask help from Senegal and/or Mauritania. We should not, because our people are dying, and it's no time for excuse. So I'm going to leave it to you, the experts, to elaborate on what you think we need.
You just briefly mentioned about, Ahmed's eloquently describe what virus is and what it does, and the test, the accuracy of the test. Where I work in Leeds, when all this started, what we used to have to always do is we would test COVID patients twice before they go to theater, because it is estimated that the accuracy rate, this could change. It's probably improved now because a lot of research and development has gone into it. Changes literally on daily basis. So what we used to is about 70% accuracy rate. So what we do is you test them once. If it becomes inconclusive or negative, then we'll do another test. So that increases the chances up. So that 30, you put another 70% to that. So it makes it the percentage smaller. So you guys who are familiar with numbers, you can probably work that percentage in your head. So
but what is the disparity between the numbers that Senegal is reporting statistically and the numbers that the Gambia is reporting? Because I have no faith in the numbers that the Gambia has provided. If you look at the total number of folks who were tested in Senegal and those who came out positive, how come our numbers are lower, much more lower than Senegal? So that's a question that someone should put to the government. Don't you think so, sir?
No, we are not just doing enough tests. WHO recommended Gambia should be doing like 40,000 tests per week, but I think they are doing less than 1,000. At the time, Dr. Ramanjai report in one of the platform, probably that improves. And I doubt very much, because then we don't have any healthcare personnel who was infected at the time. But now the infection rate within the healthcare service provider is so high, MRC have to close their doors to the public to concentrate on the numbers of their own staff that are infected.
Is it 25? Is it 25%? 25% infection rate among the medical staff?
Yeah, something like that, because Brikam alone is 23 yesterday. That is 2 doctors 19 nurses, and the other 2, I think, are support staffs. And MRC last time, the last figures I have was 32 within MRC alone. You know, the lab, almost everybody, the public health lab is infected. And these people come in contact with other people, their colleagues, so they have to put them into quarantine. I'm not even sure how they are managing. But personnel is a serious constraint right now.
Yeah, I understand it's that 30%, roughly, as far as the frontline workers are concerned. Now, if we can, because we are almost, we only have 10 more minutes to go. So we kind of will go around the table and starting with Chongan to kind of wrap it up, if you will. Chongan, if you were to sit across the table from the security folks in the Gambia, let's say the Ministry of Interior or IGP or the President himself, what exactly, what is the most urgent, or maybe give me 3 most urgent things that you believe have to be done right now at this very moment to help deal with this situation from a security standpoint, that is?
Yeah, first of all, they need to have clear guidance. I mean, medically, operationally, what they need to do. Second, and most important, is they need to get proper PPEs to protect the personnel. And thirdly, you have to look after the police and the military. You need to give them not only the PPEs, but you need to give them their allowances, their subsistence allowances, because what you don't want is morale to go down. But also, the security forces needs to know what they're doing. It's not just about arresting people and locking them up. It's also about educating people, because the security forces are everywhere in the Gambia. So all the stations, they should be linking with the alcalos, with the chief, talking to the people, telling them the threat of this thing. People should wear masks. They should maintain the distance. And people should not be sharing masks, because I've already been seen somebody who wrote, in the banks, people are borrowing masks to go to the bank because the banks are not allowing anybody inside without a mask. So somebody borrows a mask to go inside and go out. So these things are happening.
Very likely, Suguta. I wouldn't be surprised.
No, don't go there. Don't go there. It is good.
Yeah. So it is important to keep safe and to save lives. You can only keep safe and save lives if you wash your hand, use masks when you go out, use infectant, whatever they call it, this sanitizer, and also I'm saying to my former colleagues in the services that thank you very much. The nation depends on you and the medical personnel. You are the frontline workers. We need to look after our frontline workers, and this is an opportunity for the Gambian security forces, both the military and the police, to complete your redemption. This is an opportunity where you will have a complete redemption of what happened in the past. Thank you very much.
Wow, well, thank you. I hope, again, it's just a hope. It's just a hope that somebody...
Can I quickly answer Thomas' comments there? I just want to add that, you know, this is a health education issue. This is not about locking people up, you know. So the security forces need to understand this. You know, they need to, what they need to do, they need to be equipped with the knowledge of how to teach people to protect themselves rather than batons and guns. That is not the answer. If you pack people up like sardines in the back of pickup, you take them to prisons or police stations, the police will end up catching this and take it to their families. The same applies to prisons. So it's not the answer at all. You need to educate people so people know how to protect themselves. That is key. The security people need to understand that. And if it means, like you said, it all depends on operational matters. If these people have meetings and educate each other about how to deal with it, you know, then these things will come to light.
So essentially, you are saying that this idea of mass arrest, are you saying that you want, are you trying to discourage that, or you are saying it needs to be properly coordinated rather than, I don't even think they have enough space in the prisons or in the cells to all these people there anyway, but it's not that one spot in there.
No, Banka, what we are saying is, I mean, law and order must be enforced, but in enforcing law and order, it has to be done properly. What I'm saying is, you arrest 20, 30 people or 15 people, you take to a police station, they don't have masks, some of them are intoxicated. So the police need to be equipped not only with PPE, but they need to be equipped like they have masks, so that if they arrest people, they can put the mask on for you in order to protect the public and the police. So that's what we are saying. We are not saying the police to abdicate their responsibility.
But instead of
hang on. But their responsibility is more than just arresting. It's more about teaching people, sensitizing people, especially that the police is all over the country. They have stations across the board. So they need to be part of the education, coordinate with the health personnel wherever they are in the Gambia to educate the people about how dangerous this virus is, and that people need to protect themselves. That's what we are saying.
Wow. Okay. So essentially, though, when they take them to these mass arrests that are taking place, obviously they will be taking them to cells that are already congested. What do you think needs to be done with that? Because again, we all know Gambia. I mean, you were part, you were head of security of the security forces over there at Chongan, and you were
always respected human rights under Sadauda.
So yeah. No, but obviously your cells were also overcrowded too. Even you guys. But I'm just saying, what with the overcrowding of the cells, which is. I know your time it wasn't as bad because human rights was respected for the most part. Yeah. But now we have a problem.
I'm appealing to the regional commissioners who are in charge of the regions with their operations officers to be very alert where you have a congestion in a particular station, so that you can redistribute them within the region so that you don't have congestion. And also, with the heat and etc., you can take some measures, like if the police station has a secure yard, so that you can distance people, etc. So, and also the police need to find a way of negotiating with the health department so that at least there is some testing capacity with the police. The police has a medical department, so that they can have a testing capacity.
But Jones, I don't think then maybe a temporary. The government, these people need to start to get creative here. You can build a big fence and a tent with a fence somewhere where it's big and it has a tent, so that when it rains, people don't get rained over or something like that. You know what? A temporary space that is big enough to really have, just like you will have field hospitals, you have somewhere where people who are arrested for this kind of stuff are not literally mixed in with the criminals, if you will, in a prison type situation, but yet are contained in a place where a fine is what is going to get them out of there, for instance. When they are not risking, I mean, the space is bigger. I mean, don't you think they need to start to get even more creative with these things? I mean, because so much can be done to handle these things without having to endanger lives and their own, other people's lives and their own lives in a way, no?
I think, as we mentioned at the beginning, if you had a interdepartmental committee, like in England, what we call the Cobra Committee, where you had, they could have looked at all these things. I think the first step is to get enough masks for the prisoners. At least it wouldn't save it 100%, but it will reduce the transmission of infection. But as you said, the government has a lot of resources at its disposal. For example, the government could have, because there's an health emergency, they could have requisitioned a private hospital, which they make sure it's clean, it's sanitized, and then you start moving people from RWH or any of the hospitals that there is contamination, so that you can fumigate it. And then you can return those people. If you requisition a private hospital, you have to obviously pay the owner. So they have to be creative. A lot of resources have been spent. But unfortunately, in Africa, this is not just typical to Gambia. Wherever there is a massive money, 20 to 30% is consumed by administration, by cars, by fuel, by rubbish, when 80% should go into the action. So these are some of the things that we needed to do. I mean, Why do we need a conference center of $200 million when we don't even have a proper hospital? It doesn't make sense.
Yes,
You know,
indeed.
so
I agree.
we need to prioritize some of you know what needs to be done. We are in a state of health emergency. The government needs to have a strong coordinating committee. This cannot be left to the health secretary, or what do you call it, Ministry of Health, Minister of Health. There should be a cross-government organization that is dealing with this on a daily basis. And we are asking the government, pleading with them, get a daily press conference where you take questions. You can do it virtually with the journalists, telling us, the Gambian people, what actions you are taking, what are your difficulties, what you intend to do. It doesn't have to be the same minister. You can rotate the ministers, because all they need is a proper briefing, because any minister that comes will be given the statistics, and you can read your brief and you answer to the people so that there is scrutiny. We are all in this together. We need to pause about politics, about parties. Let us come together and defeat this COVID. We can do it, and appealing that let the government start to take decisive action. They should show leadership. We have to be honest with each other. We cannot just, you know, everybody who knows me, I'm not a politician, but, you know, we need some leadership. You know, the government needs to be coming out daily and informing the people what actions they're doing, what they're taking. That is important. In any functional state that happens, you know, look at all the countries. Every day they're making press conference. They're telling the people, so that you can constantly give out message that, you know, if you have to stay home, wash your hand, wear mask, etc. And also, what is the economic strategy? Because you cannot lock up people who live on a day-to-day basis, and then you expect them, or else they will, if they don't die of COVID, they will die of hunger. So all these things it's a delicate balancing act, and it needs a cross-governmental response where they sit down, they address this issue, and reach out, seek aid, seek international aid to help you before it's too late. Thank you.
Wow. Okay. Well, thank you very much. Dr. Conteh, and then Ahmed will do us the honor of the last word for the day, because we are literally out of time. Dr. Conteh.
Okay. For me, I'm going to leave this to the expert.
Okay.
Yeah. Thank you very much. First, I will give you some statistic about co-founding factors that makes COVID worse, and also some what they call in England double whammy, because the malaria season is here, and malaria symptoms. Actually, most of them are very similar with COVID symptoms. So our healthcare providers need to be very aware of this. First, the statistic. This is, I have to tell you, this statistic might be biased, because what we have this youth group in Gunjur called Gunjur Youth for Health. They've been going around for the past 3 years in open markets, you know, helping to test people's blood pressures and their blood sugar, you know, and if they found to be elevated, they advise them, you know, they actually refer them personally. So 189 people were tested. What I think happened here, this is just a speculation. Maybe these are people who already knew they have diabetes or hypertension, then they want to come and confirm, or how is their actually pressures at that particular time. But they tested 189. And out of that, 68% of 189 were found to be pre-diabetes. That means their blood sugar reading is between 5.6 and 6.9. And 47% of that 189 were found to be actually diabetes. When you come to their blood pressures, 19% their blood pressure was elevated, but medically they are not hypertensive. But 16.4% of 189 happened to be stage 1 hypertensive, and 41.8 were stage 2 diabetes, and 8.51 are actually in hypertensive crisis. So that shows that if this spread continue, the effect could be catastrophic. We are about to see a human catastrophe at a biblical proportion. So basically what I'll do in my last segment to give you the malaria and COVID, they superimpose both symptomatically and geographically. We know almost the whole world is affected with COVID-19, but malaria is about only 50%, and mainly is in sub-Saharan Africa and Southeast Asia. But the symptoms that our healthcare providers should be careful, which are common or they look similar between malaria and COVID-19, is fever. In COVID-19, you have fever and you have dry cough. But these in malaria they happen as a chills. Okay, in COVID-19 you have loss of smell and also loss of taste, sometimes, not always, and you tend to be very, very tired. But these are not mainly common in malaria. Okay, in COVID, you don't get chills, like you feel like you have been in a chamber of ice. But in COVID, in malaria, you get nausea and vomiting instead. So, but certain symptoms are common to all of them, like muscle pain and diarrhea. You can get that both in malaria and also in COVID. And shortness of breath as well, you can get it in serious cases of malaria and headache. One set of headache, in fact, for COVID, but in both of them, you get shortness of breath and also headache. So these are some of the common symptoms I want to share with our viewers. If medical professionals here, and you happen to be in the Gambia or any other malaria endemic area, this is a time when somebody come and they tested negative for malaria, you should consider testing them for COVID. And if they come, you tested them for COVID, they test positive or negative, you should go and test them for malaria as well, so that if they are COVID positive, but at the same time malaria positive, you don't miss any of them. Because if you miss any of them in this kind of situation, that's like a death sentence. Thank you very much. And Banka, don't forget our viewers. I normally bring 2 or 2 comments and then read it, and just a
well, actually I don't see the comments on my end. So if you can go ahead and read the comment, if there is any comments there that.
Okay. There is one from Sheikh Sidia Jata. He's saying, I couldn't imagine some of the finest young Gambians who are graduate and yet refuse to advise the president on the right footage. Instead, they are interested in only what will fill their pockets. And the second one is from, Sheikh Sidia Jata again. The government need to be responsible for citizens and the country at large. Time and time, we see these government and its advisors who graduated in US and UK are failing the government big time. So these are 2 of the most prominent there. Thank you.
Well, thank you very, very much, folks. So we're going to end it there. Thank you very much, Sawaneh, again, for always your expertise. Chunks, when I call Chunks, Ebrima Ismail Chongan, thank you so much. You are a patriot extraordinary, and we love you dearly. And like he's saying, they need you in that country. We need you, but who knows? Maybe someday somebody will recognize that your service you can bring a lot to the table. Let me put it that way. Dr. Conteh, thank you very much. As always, the numbers don't lie, as they say. Ahmed, I'm handing it over to you. Thank you so much. I'm glad to have helped out with the hosting today. Thank you very, very much. I'm sure next week we'll see my son Dave here with us. With his smart, brilliant analysis. Thank you, guys, and thanks to the listeners. We appreciate them all. And Gunjur Online, obviously, we cannot forget them.
Thank you.
Bye-bye.
Thank you. Bye-bye. Thank you once again.
you.